Did you know that breast cancer can come back in other parts of the body even years after it was first treated? It's a tough and surprising reality for many, but understanding how this happens can offer hope for people dealing with advanced or metastatic breast cancer.
Welcome to Cancer Treatment Updates, where treatment options for cancer are discussed openly and demystified.
Today we're going to talk about why breast cancer spreads, how it acts in different parts of the body, and the new treatments that are giving patients more options than ever before. Normally, our bodies create new cells to replace ones that are no longer needed, but when this balance is thrown off, cells can grow out of control. It's like a construction crew that keeps building and never stops. This happens because of changes in our genes called mutations. These changes can happen naturally as we get older, which is why cancer is more common with age. Some people are born with certain genetic changes that make them more likely to get cancer. But mutations aren't the only reason cells can start growing uncontrollably. There are other changes inside our cells that can lead to cancer. One type of change is called epigenetic changes. These are like switches that turn genes on or off without changing the actual DNA sequence. Imagine a light switch that controls a lamp. Flipping the switch doesn't change the lamp itself, but it changes whether the light is on or off. In our cells, epigenetic changes can turn off genes that not normally tell cells to stop growing, leading to cancer. Another type of change involves the cell's metabolism, which is how cells get energy from food. Cancer cells can alter their metabolism to get more energy, allowing them to grow and spread faster. It's like a car engine that has been modified to run faster than normal. Cells also communicate through signaling pathways, which are like messages that tell cells what to do. If these messages get mixed up, cells might start growing uncontrollably or avoid dying when they're supposed to. It's similar to traffic signals getting out of sync, causing cars to move when they should stop. All these changes, mutations, epigenetic changes, metabolic changes, and signaling mix-ups, can disrupt the normal balance of cell growth and death. When this happens, cells can grow uncontrollably, leading to cancer. When these fast-growing cells gather, they form a lump or tumor. Some tumors stay in one place and don't usually cause big problems. These are called benign tumors. But cancerous tumors or malignant ones are different. They can spread to other parts of the body. This spreading process is called metastasis. In breast cancer, the cancer cells can leave the breast and travel to other areas like the bones, the liver, the lungs, or brain. When this happens, it's known as advanced or metastatic breast cancer. So how does cancer cells move to other parts of the body? It spreads in two main ways. First, the cancer cells can push into and take over nearby areas, or they might hitch a ride through the bloodstream or the body's lymphatic system, which is like a highway for fluids and cells. Even when breast cancer cells spread to a new spot like the liver, still considered breast cancer because the cells came from the breast, not the liver. However, on this journey, the cancer cells may change, which can make them harder to treat. When doctors need to understand how cancers have changed or spread, they often perform a biopsy. This means taking a small piece of tumor to study it closely. By examining this tissue, doctors can identify specific features of the cancer and decide on the most effective treatment. In 2025, the standard approach to confirm the presence of metastatic breast cancer involves a tissue biopsy. This procedure not only confirms that the cancer has spread, but also allows doctors to analyze the cancer cells for molecular and genetic changes. Understanding these alterations helps in selecting treatments that target the cancer-specific characteristics. In addition to traditional tissue biopsies, there is a newer method called a liquid biopsy. Instead of taking tissue from the tumor, doctors draw a blood sample. This blood contains tiny fragments of DNA from cancer cells known as circulating tumor DNA or ctDNA. By using advanced techniques like next-generation sequencing, doctors can detect genetic mutations in these DNA fragments. This information is valuable for identifying specific genetic alterations that help select the most effective treatment. It also helps monitoring how the cancer responds to treatment. Liquid biopsies offer several advantages. They are less invasive than traditional biopsies, making them easier and safer for patients. Additionally, they can be performed more frequently, allowing doctors to monitor the cancer's evolution and adjust treatments as needed. For instance, we use liquid biopsies to detect specific mutations in breast cancer patients, enabling access to targeted therapies like elacestrant, inavolisib, or capivasertib that we will discuss later. However, it's important to note that while liquid biopsies are a promising tool, they complement rather than replace traditional tissue biopsies at the initial diagnosis of metastatic breast cancer. Tissue biopsies remain essential for a comprehensive analysis of the tumor's characteristics. Together, both methods provide a more complete picture of the cancer, guiding personalized treatment strategies. When a metastatic breast cancer is diagnosed, we always check for estrogen receptor, progesterone receptor, and HER2. These markers are important because they guide treatment decisions. For example, cancer cells that have ER or PR may benefit from hormone therapy, while if the HER2 is present, other specific treatments can be effective. Identifying these markers helps doctors choose the most appropriate therapy for each patient. To treat metastatic breast cancer that has high levels of estrogen receptor and/or progesterone receptor, doctors often use hormone therapy. This treatment blocks hormone pathways which some cancers need to grow. There are different kinds of hormone therapy medicines, each working in its own way. Tamoxifen, one of the oldest ones, is a medicine that attaches to the estrogen receptor on cancer cells, blocking estrogen from helping the cancer grow. It's often used in both early and advanced breast cancer. Aromatase inhibitors are drugs that lower the amount of estrogen in the body by stopping an enzyme called aromatase from changing other hormones into estrogen. They're mainly used in postmenopausal women. Examples include anastrozole, letrozole, and exemestane. These are all aromatase inhibitors. Fulvestrant is a medicine that blocks and damages estrogen receptors on cancer cells, reducing the cancer's ability to use estrogen. It's often used if other hormone therapies are no longer effective. In recent years, doctors found that combining hormone therapy with a group of medicines called CDK4/6 inhibitors can be more effective. These inhibitors, such as palbociclib or Ibrance, ribociclib or Kisqali, and abemaciclib or Verzenio, work by blocking proteins that help cancer cells divide and grow. Studies have shown that this combination can help patients live longer compared to hormone therapy alone. Hormone therapy can also be combined with targeted therapies like elacestrant if there are mutations in the estrogen receptor. If there are specific changes in a group of genes called PI3 kinase, AKT, or PTEN, a new group of treatments are also available like inavolisib or capivasertib or alpelisib. If hormone therapy doesn't work, chemotherapy is often used. Chemotherapy is a strong treatment that attacks cells that grow quickly, like cancer cells. But because it can also affect healthy cells, it's given in cycles to let your body rest in between. Newer treatments are also making a big difference. Targeted therapies are designed to focus on specific parts of cancer cells without harming healthy ones. For example, HER2 inhibitors, like a medicine called trastuzumab deruxtecan or Enhertu, block a protein called HER2 that helps some breast cancers grow. These treatments are improving survival, and Enhertu was initially approved for patients with high levels of HER2 in the tumor, and it can also be used in patients with lower levels of HER2, so-called HER2 low. Radiation therapy is another option when cancer spreads to certain areas, like bones, and to palliate and relieve pain. Advanced techniques like stereotactic body radiation therapy are very precise, targeting cancer cells and sparing healthy tissues. Other medications like bisphosphonates can help bones get stronger and decrease the risk of fractures and alleviate pain. Immunotherapy is a promising field that enhances the immune system to combat cancer. One approach involves immune checkpoint inhibitors, which help the immune system recognize and attack cancer cells. For instance, drugs targeting the PD-1 or PD-L1 pathway, like Keytruda, have shown effectiveness in treating certain types of breast cancer, such as triple-negative breast cancer, that expresses the PD-L1 marker in the metastatic setting. Another innovative area under investigation includes CAR T-cell therapy and personalized cancer vaccines. CAR T-cell therapy involves modifying a patient's T-cells to better recognize and attack cancer cells, while personalized vaccines are designed based on the specific genetic makeup of an individual's tumor. These experimental treatments are currently being evaluated in clinical trials to assess their safety and effectiveness in metastatic breast cancer. While promising, they are not yet approved for widespread use until more evidence supports their benefits. Of course, treating the body isn't the only part of the story. Getting an advanced metastatic breast cancer diagnosis can be scary, not just for the person with cancer, but also for their family and friends. It's important to have a strong support system, whether that's loved ones, support groups, or both. Talking openly with your healthcare team can also help you feel more in control and prepared for any changes along the way. If you or someone you love is living with advanced metastatic breast cancer, remember you're not alone. There are many resources, clinical trials, and communities ready to help. Living with cancer is hard, but with the right knowledge, support, and treatments, brighter days are possible.